Do you struggle to understand how the NCLEX is asking you? Do you know how the chapter correlates with this NCLEX by in order to pass your NCLEX?
Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
In today's video, we have coordinating care for patients with burns. Please stay curious, stay informed, and keep learning. Like, share, and subscribe. Please comment where you struggle with this chapter. So for the NCLEX, they will ask you on those categories here. There are 15 domains. So the NCLEX is broken into 15 specific areas. And it's not just by knowing your content, it's about how you apply in different situations. I call it those domains include like the traditional 8 right here, the 8 categories like management of care and psychosocial, safety, health promotion, basic care and comfort. And the clinical judgment, which is hugely focused on the new exam. And I call it all 15 domains. I'm going to present what here. This is a pie that in order to pass NCLEX, and you need to have above on all of the above, all those 15, you need to go and make sure that if you want to pass with 85 or 75 or 100, a question might have like 2 from the pie, or just related to one section. Management of care, it's huge, and also pharmacological here, it's huge for the RN. Basic care also, it's like about 9%. Imagine you aim for 100 questions, and almost 10 of them it's about basic care and comfort, and you need to have above of this. And there are a lot of case studies, cases in the NCLEX. I heard like some people, they have I think 6 in the NCLEX, and a lot of selector of the apply and a lot of tables to go. It's like true or false. Yeah, so making a connection to clinical judgment, recognizing the cues. It's like what clinical manifestation are observed in this patient. Analyzing a cue, how do the clinical manifestation correlate with the underlying pathophysiology. So it's very important to know the pathophysiology of any disease. And imagine that one case study in your NCLEX is about burns or skin itself. So this Med-Surg has 3 chapters: the assessment, like overall of everything, then some diseases that affect skin, and this chapter about burns. because it affects the skin. And also cancer, but cancer also it's in another chapter of the book. So make sure, like, imagine that your patient has burn, like, and now you need to complete this pie here. So how are you going to do to have all the above? So pathophysiology, right? It's for analyzing the cues. Then prioritizing hypotheses is like what could happen if the patient's symptoms are not effectively managed. Generate solution. It's what treatment are included to manage this patient condition. Taking action. What are the priority intervention for this patient? Evaluating outcomes. What findings demonstrate that the patient plan is effective? What follow-up data are still needed? And so I'm gonna review a little bit about the burns in case you haven't listened for the burns outline for the burns, and then I will show you examples from all my 15 domains, like I always do, example of these, very little, and then I will do 15 questions, but I think this time I put 16 in this video, will be 16 because at the end, the last one, it's the pathophysiology. So you're gonna see the pathophysiology of from here. So let me introduce the chapter. We review chapter 51, coordinating care for patients with burns. It's a very heavy chapter, and many students will struggle with this. So what I understand and how I read from Davis Advantage Medical Surgical for Nursing, I made this the concept map, and I'm gonna go one by one. I don't make many slides, but I talk this. So the introduction, they talk about learning objective, like essential terms, and they start with a case study, episode 1. Then here with incidence and epidemiology, they talk about the burn center referral criteria. It's a box 51.1. Statistics on fire, death, and injuries, common etiologies like fire, flame, scald, contact, electrical, chemical. Demographics and the risk factors by age, sex, socioeconomic factors, burn prevention strategies, box 51.2 and 51.3. On pathophysiology, it's classified in classification, anatomical changes and functional changes. Classification, it's the burn etiology like thermal, electrical, chemical, radiation. Burn depth is like superficial, partial thickness, depth, partial thickness, and full thickness. You have pictures and you need to memorize the key terms for this, and you need to know what those means. They talk about the total body surface area percentage. We call it TBSAP as just as a shortcut. So it's a rule of palm, rule of nines, along then the Bronder classification. Then we have the severity, inhalation, injury, age, past medical history, location. For anatomical changes, they concentric zones of burns, like zone of coagulation, zone of stasis, zone of hyperemia. Functional changes, risk for long-term morbidity in functional area, face, hands, feet, major joints. What I just said, like zone of stasis, zone of hyperemia, zone of coagulation, those are key terms. Find also in the book. I already posted the terminology for this chapter that I kind of explain in our own words what that means. The systemic effects of major burn injuries. Here it's the by respiratory, so it's like inhalation injuries, carbon monoxide poisoning. Cardiovascular, it's like burn shock, distributive and hypovolemic. Fluid electrolytes, hyperkalemia, hypokalemia, hyponatremia. Renal, it's decreased perfusion, myoglobinuria. Gastrointestinal is decreased mobility, abdominal compartment syndrome. Metabolic, it's hypermetabolic state, increased caloric needs. Immunological, it's systemic inflammatory response syndrome, it's SIRS. Sepsis, leading cause of death after emergent phase. Then 5, special consideration in the patient with burns. Inhalation injuries, it's like diagnostic, management, carbon monoxide treatment. Electrical injuries, it's contact points, cardiac monitoring, myoglobinuria management. Chemical injuries, immediate irrigation, acid alkalis, organic compound. For here is charotomies and fasciotomies. They are keywords. Look what that means. Management of compartment syndrome and circumferential burns. The interprofessional management of burn injuries. Here we have who is in for the patient. So it's like nurses, doctors, and dietitians, PTOT, and then we have the phases. Emergent phase, it's resuscitative. Medical management, it's primary or secondary survey, diagnostic studies, airway maintenance, fluid resuscitation using ABLS guidelines, prevention of hypothermia, pain management, medication. Nursing management, it's assessment, intervention, and outcome. For immediate phase, medical management, wound care, hydrotherapy, clean technique, topical agents, debridement, surgical excision, and grafting, autograft, allograft, xenograft, pain management, nutritional support, prevention of infection. Nursing management, same, assessment, intervention, outcomes. Rehabilitation phase for medical management is psychosocial support, physical occupational therapy, complication, contractors, scarring, pressure garments. Nursing management, assess, intervene, and outcome. The palliative care, the role in minimizing suffering, aiding decision making and providing family support. Other condition in treatment in burn center, they have the Steve Johnson syndrome and toxic epidermal necrolysis, and the other condition can be like necrotizing fasciitis, frostbite, etc. So this is just a little bit of everything. This is a formula that you need to know, example calculation using an example from the chapter. And here it's a general formula for milliliters factor times weight in kilograms times percentage of TBSA burn. So the the millimeters factor depends on the patient age and type of injury. 2 ml factor for adults is 15 years or greater. 3 milliliters factors for children 14 years or younger. ml factor for all ages with electrical injuries due to extensive internal damage. So what do we know about the burns? Burns are classified by the cause of the injury, in depth of the tissue damage, and the total body surface area, TBSA, involved in the burn. 4 categories are used to define the depth of skin and underlying tissue damage. Superficial partial thickness, partial thickness, and full thickness. So we said that. Now let's say a superficial burn involves only the epidermal layer of the skin. Mild redness usually lasts 24 to 72 hours. No medical intervention is necessary with a superficial burn. A superficial partial thickness burn involves not only the epidermis but also the superficial layers of the dermis. This type of burn is painful because the nerve ending within the dermal layer are damaged. Open blisters are also present. Treatment depends on the TBSA involved and the location of the burn. A superficial partial thickness burn typically heals within 2 weeks with no scarring. Next, a deep partial thickness burn involves not only the epidermis and superficial layers of the dermis, but also extend into the lower layers of the dermis. The skin appears waxy and the patient might experience both pain and loss of sensation in the damaged area. Nursing care focuses on preventing infection. Surgical intervention such as grafting may be required. A full thickness burn involves all layers of the skin, cutaneous tissue, and often muscle and bone. Pain is absent because the nerve endings are destroyed. Eschar or blackened end the tissue is noted. A full thickness burn requires surgery and skin graft to heal. Factors that affect the sensitivity of a burn include the physical location of the burn, the patient age, his or her medical history, and whatever an inhalation injury also occurred. Burns that affect more than 20% of TBSA cause systemic responses in addition to localized tissue damage. They can also affect the respiratory, cardiovascular, renal, gastrointestinal, metabolic, and immunological system. The body fluid and electrolyte balance is profoundly affected due to compromised integumentary system. With complex burns of this kind, it is almost impossible to avoid sepsis. All possible infection control measures must be in place to reduce this risk. Medical intervention is necessary for any type of burn other than superficial. It may be difficult to fully evaluate the status of a burn within the first 24 to 72 hours. Frequent throughout assessment and monitoring for the systemic complication by skilled health provider is required during this period. And this was my little summary for the chapter. Now let's go how NCLEX will play out this chapter. I hope you can still read. It's very small. I put the whole page to make sure we'll have enough space here and to see everything at one glance. Here my NCLEX domains: management of care, safety and infection control, health promotion, psychosocial integrity. So let's go what to do. Prioritize SBC, coordinating interprofessional burn team. I'm gonna take this light in case you want to take a short screen. I talked about the Parkland formula, 2 to 4 ml per kilogram. Infection indication like temperature, we have in Celsius, more than 39 Celsius. The white blood cells, more than 12,000 or less than 4,000. New drainage sepsis increases heart rate, decreases blood pressure, and same as platelets. Make sure that your patients have a tetanus booster every 10 years or within 5 years for burns. We have morphine here on IV. Use as bar handout for payment. You have a pain reassessment within 30 to 60 minutes. The map, ABC framework, glaucoma scale, ABLS guidelines, fluid rate, first 8 hours. Urine output is very important. You have more or equal than 0.5 ml per kilogram per hour. Temperature, heart rate, wound healing, prognosis. Let's go basic care and comfort. Maintain warm, elevate burned limbs, provide pain relief and hygiene. Position to prevent contractures. Apply ice to burn worsens tissue damage. So this is red flag if you apply ice to burns. Neglecting pain before wound care. This is also a red flag. Clinical judgment, integrate patient cues, vital signs, urine output, pain within intervention, reassess and document. Red flag traps, acting before validating cues, failure to trend labs. So here you need to always use the S bar handoff like as a documentation. And evaluate outcome, very important. Assess response, make sure the vitals are stable, urine output is adequate, pain relief, no infection. Red flags, failing to reassess after intervention or wound care. So now we go to the next slide, similar like this. Here we have a very orange table. Little bit like high yield topics for burn, what the items ask you to do, and classic Pitfalls trap. Let's go with basic care and comfort, pain control, IV opioids, warmth and positioning, prevention of contractures, and range of motion exercise. Select intervention for comfort and function. Classic pitfalls traps, applying ice. We just said earlier, so don't use ice. Omitting scheduled pain meds before dressing change. So this might be give medication prior wound care, or even if they have to do PT, also make sure has no pain, and to give more comfort while so the patient needs to tolerate well. The insurance, especially Medicare, likes while a nurse provides wound care or range of motion. In documentation, a nurse needs to write patient denied pain, tolerated well the wound care, or tolerated well the range of motion. No issues observed. So make sure this is very important for Medicare. And NCLEX might ask you the same. Pharmacological and parenteral therapies, IV opioids like morphine, fentanyl, hydromorphine, LR for fluid therapy, anticoagulant nutritional support, choose correct medication, route and timing, and then giving IM meds in edematous tissue, giving prophylactic antibiotic without culture. And you need to do the culture and then we start the antibiotics. Evaluating outcomes, check for adequate resuscitation like urine output, vital signs, infection control, pain relief, mobility progress. Determine if intervention worked and what to do next. Assuming stability without a reassessment, missing secondary infection. So that's very important. I'm going to show you another two little tables. Two little table, very important to take a note in the short screen. Here there are some significance or these parameters, and here there's some little notes for this value range concept. So here, for instance, it's potassium increase early cell lysis, which will lead later to diuresis. So replace carefully. Sodium decrease due to third spacing, replace via LR. Here the urine output, the formula, and this is the best indicator of resuscitation. And another formula here for TBSA fluid formula. Temperature goal, tetanus, pain control. So this little table, it's nice and neat. We have a domain, NCLEX domain management of care for fluid resuscitation and emergent phase. I hope you still remember the emergent phase. A nurse in the emergency department prepares to administer AV fluids to a patient with 40% TBSA burns. Which prescription should the nurse question? A. Lactate ringer, the LR, at 500 ml per hour, normal saline bolus of 2 liters. C. Insert 2 large bore IVs. D. Titrate fluid to maintain urine output of 0.5 ml per kilogram per hour. Correct answer is, so which prescription should the nurse question? The normal saline bolus of 2 liters. And because normal saline causes hypercholeremic acidosis, the LR is for resuscitation fluid of choice in burns. We go to the next question. The topic is burn wound infection precaution. The NCLEX domain, safety and infection control. Question: the nurse cares for a burn patient. So the nurse cares for a burn patient with an open wound. Which action by the nurse indicates correct technique? A. Using sterile gloves for dressing changes. B. Reusing clean gauze if not visibly soiled. C. Performing hand hygiene before and after wound care. D. Removing dressing with bare hands. So, indicates correct technique. Performing hand hygiene before and after the wound care, because hand hygiene is the most effective infection control measure. Clean technique is used for dressing care, and you don't remove dressing with your bare hands unless it's your own little paper cut and you have a band-aid, and yeah, you can just take it, but not to a patient. Even if it's a patient has a band-aid, you do not use bare hand, you use glove. Next question. Burn prevention domain, NCLEX domain, health promotion and maintenance. Question. The nurse provides teaching to patients about home safety for a toddler. Which statement by the patient indicates a need for further teaching? So it's home safety for a toddler. A. I will turn pot handles towards the back of the stove. B. I will test bath water temperature before bathing. C. I will use space heater in my child's room for warmth. D. I will cover unused electrical outlets. So indicates a need for further teaching. Means that 3 are correct and 1 it's no good. I will space heaters in my child's room for warmth. No, you don't do this because space heaters are major cause of home fires and burns, especially in children. They play, they throw things around, they run in the room, etc. Next question about body image and adjustment. NCLEX domain, psychosocial integrity. Question. A burn patient expresses sadness about facial scarring and refuses to look in the mirror. What is the nurse's best response? A. You will get used to your appearance soon. Oh my God. Makes me laugh, but I've been having those questions in even in LVN, like so many of them during the practice or stimulation questions for the passing exam. You'll get used to your appearance soon. Being you should look at yourself so you can move on. C, it's okay to take your time. Would you like to talk with the counselor today? D, at least your burn are healing well. So what is the nurse's best response when a patient that has a burn looks sad about the face? So the best answer is, it's okay to take your time. Would you like to talk to a counselor today? Yes. Offer emotional support and referral to psychosocial services. Avoid minimizing or forcing confrontation. We go to the next question. Topic, pain control during dressing change. This is huge. NCLEX domain, basic care and comfort. Question, before a scheduled burn dressing change, which action should the nurse take first? A, administer prescribed IV opioids 30 minutes before the procedure. B, encourage the client to practice deep breathing afterward. C, offer an analgesic immediately before change. Why immediately before? D, document pain after completing the procedure. So we have administer prescribe IV opioid 30 minutes before the procedure, not immediately. The IV opioids are preferred for severe procedural burn pain. Must be given before care begins. Next topic, it's medication administration, GI prophylaxis, NCLEX domain, pharmacological and parental therapies. A patient with 35% total burn surface, burn receives famotidine, Pepsid. The nurse, because it's a GI, the nurse understands the medication prevents A. Electrolyte imbalance, curling ulcer, C. Fluid overload, and D. Hypothermia. Here is making so obvious. This is very simple to see it, but I haven't seen like because you know it's a GI medic. It's about. I mean, I knew here is a GI, but here it's a GI. So here it's only one about GI, the ulcer, even if you don't know what this means. So you see ulcer, nothing it's regarding GI. So the H2 blockers like ratididine, prevent stress ulcers, curling ulcer, causing by burn-related stress response. Topic: compartment syndrome. NCLEX domain, reduction of risk potential. Question: which finding in a client with a circumferential burn to the leg require immediate provider notification? Pain 8 out of 10 control with opioids. B. Capillary refills more than 2 seconds. Numbness and increasing pain despite analgesic. D. Red warm wound edges. So these you have controlled with opioids. So between these two, it's numbness and increasing pain despite analgesic. And increasing pain and revealed by opioids with numbness indicates compartment syndrome, an emergency. Burn shock topic, domain, NCLEX domain, psychosocial adaptation. Question example: which assessment finding indicates effective fluid resuscitation in a burn patient? Urine output 20 ml per hour, heart rate 110 beats per minute, systolic blood pressure 85, D. urine output 45 ml per hour. The correct answer is urine output 45 ml per hour. So this indicates fluid resuscitation in a patient. So it's more than normal. Adequate fluid resuscitation is reflected by urine output 0.5 ml per kilogram per hour, or about 50 per hour in adults. 50 not, but 30. This is the standard, 30 ml. Topic: interpreting clinical findings, NCLEX domain, clinical judgment. The nurse notes a burn patient blood pressure drops from 110/70 to 90/60, and urine output falls from 40 ml per hour to 10 ml per hour. What is the nurse's priority? A. Increase fluids, IV fluids per protocol. B. Notify dietary for more protein intake. C. Administer diuretic as ordered. D. Document findings and continue monitoring. So the priority is to increase IV fluids per protocol because a drop in the BP it's blood pressure, and urine output indicates hypovolemia. Increasing fluids is the priority action. Next. Topic, airway assessment, NCLEX domain, recognizing Q. So we're getting close to the end, right? Which assessment finding in a burn patient requires immediate intervention? Thickened nasal hair, blistered forearm, complaints of thirst, edematous legs. So it's which assessment finding in a burn patient require immediate intervention? Thickened nasal hair, because those indicates inhalation injury. Airway must be secured early due to risk of obstruction. So this, you see how the NCLEX domain means recognizing the cue. So this is the assessment and requiring immediate intervention. So you know, oh wow, this is very important because of airway, right? Analyzing Q, NCLEX domain, analyzing Qs, the topic, lab interpretation, electrolytes. So this also can be NCLEX domain, analyzing Q, and pharmacological, just to kind of have an idea because it's a lab. A burn, a, a burn patient's lab shows sodium 130. Potassium is 5.8. What does the nurse conclude? A. Fluid overload. B. Early burn shock phase. C. Late diuretic phase. D. Renal failure only. So what the nurse conclude? And early burn shock phase causes hyponatremia, third spacing, and hyperkalemia, cell lysis. Topic, ABC prioritization. NCLEX domain, prioritize hypotheses. Which nursing diagnosis in the highest priority is the highest priority for a patient with 30% TBSA facial burns? A. Risk for infection, impaired skin integrity, ineffective airway clearance, and acute pain. It's ineffective airway because airway always takes precedence, like ABC, and facial and inhalation burns, the highest, because it's here facial burns. We have topic, professional plan of care, NCLEX domain, generate solution. The nurse collaborates with the dietitian for burn patient care plan. The plan includes A. High calorie, high protein meals with early enteral feeding. B. Low protein, low fat meals to reduce workload. C. NPO status until Graft here. D. IV glucose to maintain caloric source. Correct answer is high calorie, high protein meals with early enteral feeding, because burn patients are metabolic, high protein, high caloric diets promote wound healing and prevent catabolism. Topic: emergency burn care, chain management. NCLEX domain take action. The nurse arrives at the scene where a patient's clothes are on fire. Which action should be taken? Select all of the apply. A. Stop the burning process. Apply ice directly to burned skin. Remove smoldering clothes. Cover the patient with a clean, dry blanket. Apply ointment to the open wounds. Stop the burning process. Remove smoldering clothing. Cover the patient with a clean, dry blanket. So stop burn process, remove heat source, and cover with clean, dry cloth. Ice and ointment worsen the injury. Topic: evaluating fluid resuscitation. Domain, NCLEX domain, evaluate outcomes. So this should be the 15th question. But I still have another one about pathophysiology. So which finding indicate that fluid resuscitation in a burn patient is effective? Select all of the apply. Heart rate 98 beat per minute, systolic blood pressure 110, urine output 50, CVPN, CVP 2 millimeters, confusion and dry mucous membrane. So evaluate outcomes, which finding indicate that the fluid resuscitation in a patient is effective. Heart rate, so it's within normal ranges. Systolic looks good. Urine output, okay. Stable vital signs and urine output reflect adequate perfusion. Low CVP and confusion indicate under resuscitation. Topic: burn pathophysiology, NCLEX domain, physiological adaptation. Which pathophysiologic process explain hypovolemia in the early burn stage? To understand what means pathophysiology in NCLEX questions or stimulation, here the second part, when a nurse needs to explain the hypovolemia, like a family member or a patient, or a nurse explains to a new nurse about hypovolemia in the early burn stage. Just to kind of have an idea how the pathophysiology it's and in NCLEX and questions and how it plays out, that it's very important to know pathophysiology of each chapter, and each chapter has a specific criteria that you need to know. So now we're done about burns and we have burn pathophysiology. And one question, and here choice A, it's loss of plasma protein through urine. Y, decrease capillarity permeability. C, fluid shift into interstitial space, third spacing. Decrease antidiuretic hormone secretion. The correct answer is C, because the burn injury increases capillary permeability, not decrease. So increases, causing plasma and electrolytes to leak into interspatial spaces, leading to the third spacing and hypovolemia. I hope this chapter make it easier to understand. I hope it's what you looked for, and I will see you in the next one. Thank you. Like and subscribe. Thank you. See you next time. Bye for now.
We finally made it! Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.